Hello, welcome to Oncology Spotlight Expert Insight. I am Yüksel Ürün, your host for today. I am medical oncologist at Ankara University, Turkey, and interested with GU Oncology. Just after the ASCO GU Cancer Symposium, I will be discussing today with you the KEYNOTE-B15 study, which is the new adjuvant and adjuvant enfortumab vedotin plus pembrolizumab for patients with muscle-invasive bladder cancer who are eligible for cisplatin and randomized open-label phase 3 study presented by Matt Galsky. And in this study, actually, this is 1:1 randomized for enfortumab vedotin plus pembrolizumab. And in control arm, we have a standard of care, which is cisplatin gemcitabine for patients. And after the radical cystectomy and pelvic lymph node dissection, patient continue with enfortumab vedotin and pembrolizumab. And of course, in the chemotherapy arm, the standard was observation. And the primary endpoint of this study is event-free survival, and key secondary endpoint is overall survival and pathological complete response rate. Actually, in this study, event-free survival is being primary endpoint, and which is one of the frequent endpoint used in previous study too, and it's evaluated for ITT population. And of course, in this study, and more than 800 patients undergo the randomization. In one arm, 400 for EV Pembro and 400 for cisgem, and almost 90% of all patients in both group go to the surgery after the neoadjuvant chemotherapy. The baseline characteristic of the patient is well balanced, and which is we all know for patient with bladder cancer, mostly male, and medical median age is around 66, and most of the patient present with ECOG 1 and ECOG 0, and most of the patient is T3, T4 diseases. There is almost no N2 diseases. And of course, the study met its primary endpoint, which is event-free survival. At the 2 year, it's like a 13% absolute gain for event-free survival. And in GemCis arm, the median is like almost 4 year, and EV Pembro is not reached median, but at 2 years, there is almost 80% of the patient in EV Pembro arm and 66% of the patient in GemCis arm is event-free. Of course, and also in OS data, in 2 years, there is absolute 5% gain with EVP, and hazard ratio for OS is 0.6. And of course, also PCR, pathologic complete response, is one of the endpoint for us in patient with muscle-invasive bladder cancer. And for many years, we start with 40%. And now in this study we have 55% complete response rate, which is really something we always wait for patient with bladder cancer. Of course, this is have one of the practice change trial from the ASCO GU, and of course there is several ongoing critics in this. Of course, patient in GemCis, the number of patients getting adjuvant immunotherapy is less. Of course, there is the toxicity, but well balanced between two arms. But what we can say for this study, and also we know in patients with cisplatin ineligible, also EVP improve event-free survival and the overall survival. With that, it seems EVP could be one of the candidate regime for patients with muscle-invasive bladder cancer, regardless of cisplatin eligibility. Of course, we cannot make cross comparison because of every study has different patient population, but when you compare with the other trial like a Niagara, KEYNOTE-905, regarding the event-free survival and overall survival, both EVP provide almost 80% event-free survival and more than 80% 2-year overall survival. So from the ASCO GU this year, this bladder cancer trials, I believe will be one of the standard of care in the coming days. Of course, the accessibility remain the problem across the different country. For example, in Turkey, I don't expect soon it will be approved for reimbursement. But if it's became accessible, it will be one of the standard of care for our patients. Thank you.